Oh, recording.
Let's
You have
see.
to let me in.
We have to let you in.
You see on like the bottom, maybe
Participants?
Does it say, like the bottom.
This is so different than what we've had
Lisa.
happen. There you are. Thank God. Okay. Hi.
Okay, booyah. Now,
And then,
we still have some participants.
so
like
did it.
13
okay, great. So people
No,
are
there's-
coming back,
Okay, people are coming back.
right?
Hi, people. Well, we have lots of questions.
I know we have so
You guys
many.
are so funny, by the way.
Hi, Lisa.
Also, the
This is
Dewey Duck
Allie.
Mississippi.
Hi.
Hi, Allie. So funny.
That was just a total error on my part. I sent you the wrong link.
No worries.
Okay. So is everybody, do we think that they're coming
Okay,
back
do we have
in?
anyone back here? I'm going to text Kristen.
Yeah, let's just,
She's
I know.
this horse since the
we're getting
kids.
so much grief from people who love us.
Oh, look, they say they're back.
Okay,
Yay!
thank
As they should.
Okay,
So
can
now
you
we're just
figure
going to give them a
out
few
how to have
minutes
both
to get
screens up
in.
at the same time instead of just a speaker. Yes, I
Okay.
can. I think I can do that. Hold
But
on
can
one
we
second.
take lessons from Lisa right now? Because
Lisa,
I
look, you're being
tried,
so chill.
first off, she just looks so good.
Yes.
And your background is so good.
This is all boy. I can't really take a lot of credit for this, but yeah,
Can we hire that boy? Could he fly across
Yeah.
the country?
he is good at some things. Yeah,
Well, and he's funny.
he's funny. I do. I
Yes.
love him today. You know, I say I love you today.
Everyone says they're back.
Okay.
This is the good news. They might have had to rejoin.
I'm just turning
Yes.
our
Oh,
volume.
Christy's back too.
Okay, great. Okay.
Okay, good.
So then I think that just so we can just get going, Lisa, do you want to just introduce yourself and then we'll
Sure.
just dive in? And
Yeah,
thank you for
sure.
being patient with us.
Yes.
Oh
Thank you.
yeah, you guys are so cute. So I am Lisa Lippman. I am a veterinarian. Let's see, I'm from New Jersey originally. If you can make an original joke, I'll be very impressed. Somebody. I did veterinary school in California, so of course I just missed you, Carrie. I would have traveled all the way there to go see you and all the babies. I did like 100-hour work week internship at a Blue Pearl in Manhattan. Have mostly spent most of my career and actually all of my career in New York City, really. For the past 11 years or so. Did general practice, emergency practice, joined a house call practice, started my own house call practice. I am currently the senior director of virtual medicine at Bond Vet. So basically I run the telehealth program there. We have about 60 hospitals now. If you haven't heard of it, we're not in California yet. We're sort of like the modern animal, but we have like 20 to 30 practices in New York, and then New Jersey, Virginia, DC, Chicago, Connecticut, Maryland. We're coming though. We're coming there. And so, yeah, if you want to talk to me, you can come in and talk to me at any time. Well, it depends on what state, if I can prescribe for you or not, but that's all laid out on the website. I can talk to anybody about anything though at any time. So
I just have to ask, this was unscripted, but how does that work? Like, let's say that like one of my dogs has an ear that's
Yeah.
a little yucky. Like how then, what's the process from there?
well, it depends. So if you're in California, I can't prescribe. So basically I would just tell you, it's like a triage, like do they need to be seen, what to expect, things like that. So I can just walk you through all of that. You know, if you're wondering, do I need to take my dog in or not? I think my glasses are crooked. Sorry guys, I'm just realizing this. Anyway, but if you are in one of the 7 states that I can prescribe for, New York, New Jersey, DC, Virginia, Massachusetts, Illinois, Pennsylvania, then I can prescribe for you. I'll always go through all of the pros and cons. You know, we always say telehealth does not replace a yearly physical exam. It's an adjunct to. So it's really nice when you have that yearly physical exam and I can kind of go off of what, you know, the other vet sees. And then I'll tell you, you know, the pros and cons. So for example, with like an potential ear infection, you know, it's nice if you go in, they can clean it out for you. I also can't look and see if like the eardrum is intact. If we put medication in an ear where an eardrum is not intact. Actually, anytime that you put medication in an ear, and this might be interesting because ear infections are so common, but anytime we use medication in an ear, there can be the potential for ototoxicity where it can cause a deafness. The medication can actually get past the eardrum and cause deafness. It's very uncommon. It has never happened in my hands in my like 11 years of practice. I have seen it happen. And then I've seen people like very upset because they weren't told. Now there's a new law in New York that like requires us to disclose, you know, things like this. I think a lot of vets still don't because again, it's still so rare and it's really our very best first line treatment for ear infections, but there is definitely always a small risk of that. But yeah, so I'll go over all of that with you and the pros and cons, and then decide, if you want to treat. For a lot of people, they're risk takers. So it depends how risk averse you are. But there's a lot of things that we can do. Really, we see a ton of behavior, a ton of like separation anxiety, pre-vet anxiety, pre-vet sedation, trazodone, gabapentin, things like that. So
Amazing. I mean, that's
Yeah.
really, I didn't realize that.
yeah, thank you for, right. I don't talk about it a ton actually on Instagram. I probably should talk about it a little bit more. I think it is kind of interesting, but yeah.
And people who are in areas where getting to the vet is difficult, that's a really great option.
That's right.
Yeah.
Triage so that do you need to make that 2-hour trip to the vet or not, and I can kind of help you determine that for sure.
But I do love your Instagram, and I love that you're always really honest. Like, I loved the little Barfarama video that you posted yesterday.
That was so funny.
Right, where I'm not perfect. Yeah, we were thinking of all the things last night that Herbie got 2 pieces of chocolate last night. I left them on my computer.
After the earplugs.
The earplugs, in fairness, the earplugs were several months ago.
Oh, okay.
Yeah, I am not perfect. I don't think any vet is, and yeah, we'd be lying if we say that we are for sure. But thankfully, we've never had anything major happen. So yeah.
Yeah. Okay, well, go ahead.
I'm going to just make one quick comment to everybody who's participating, because usually this is what I do at the beginning. People are going to be putting questions in the question and answer. And what we're going to do is we're first going to go through the list of questions, and then we're going to see what we can get to in that question. So I'm not ignoring you. I see the questions coming in, and we'll get to those. I promise, as many as we can within the time that we have, which we might want to go a little bit over.
Well, that's what I was
or-
just going to ask Lisa. Are you a hard stop at?
You're good. We're good. Anything for you, Carrie.
Thank
Aw.
you.
And now Allie.
Yeah, yes.
I should say, Lisa, I mean, I meant to have my book with me and I don't, but if you look at your copy of Puppy Brain, you will see Lisa's endorsement on there, and it was so kind that you did that. I was
So honored that you asked me to. So honored. I just adore you. I mean, nobody does it like you do, Carrie, I think. So it's true.
It's the truth.
Well,
Okay.
we're gonna do a little lightning round before we get into the hardcore
Do
questions.
some fun
Just some fun. And I don't know what they are. I told Allie I don't want to know because it makes it more fun.
Yes. Okay. Yeah. That way I can feel like I could. I'm just gonna ask you guys some silly questions. So, who was your first celebrity crush? You go first, Carrie.
Oh, I go first?
Yes.
Oh, well, I mean, does Speed Racer count as a celebrity? I used to kiss the TV.
I have to Google that.
I did.
You
Okay.
kissed the TV for
Yes.
Speed Racer?
Yeah, that's my
This
lightning
is
answer.
such good facts.
Okay,
Okay. What
Lisa.
about you, Lisa? Who's your celebrity
It
crush?
had to have been like Jonathan Taylor Thomas, I think.
Oh, Jonathan Taylor Thomas.
Home Improvement. Does
Home
that-
Improvement. Okay.
Wait, I have to Google Speed Racer.
There he comes. There he
What's
comes,
so
Speed
much-
Racer. Dun, 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 dun. Okay.
So much.
Okay.
All right. Okay. Let's see here. What's the maximum number of spritzes of perfume before it's too much?
Wait, then Formula One must really turn you on, maybe. But I think I'm like a 0 to 1. I'm very fragrance sensitive.
Fragrance sense. Okay. What about you?
I use 2 at most.
Two
Yeah,
spritzes.
yeah.
I do. I know it's not really me. I do one, and then I walk into it, and then I maybe take what's left, just because I have friends that are sensitive too. Okay. Next question. What's for dinner tonight?
Trader Joe's canned chili.
Okay.
That sounds great. Probably sushi.
Sushi.
that
That
sounds
sounds
great.
easy.
I'm just that New York bee. Yeah.
Okay. Let's see. Who's your favorite Harry Potter character?
Hermione. It's got to be Hermione. I mean, it's relatable.
Yeah.
100%.
Kind of type A.
Harry's your
Hey, why-
favorite?
Kind of type A, uptight.
Yeah.
See, I'd be a Remus. Remus. Now I can't remember his last name. Lupin. He's the werewolf. I love him.
oh, yeah.
Anyway, okay, that's weird.
Or
Let's
Professor
go on to the
Snape,
next
he's kind
thing.
of cranky,
He is kind of cranky. I kind of like it that way.
like me. Yeah.
Weirdly. All right. So here's a weird one. Do you like the word dapper?
Yeah.
I do.
You do, and
Yeah.
you do. See, I think I do too. Okay.
Okay.
Next, if you could travel back in time, what period would you go to?
Sounds like it's all pretty full of disease. I don't know.
Spoken by a scientist,
good.
by a
Yeah.
doctor.
That is
What
so
would you
good.
What would you pick?
Gosh. You know what came to my mind
Okay.
immediately, and it's
What?
not traveling in time, but I love Chronicles of Narnia. And that
Oh,
opening scene, you know, when
yeah.
Aslan, like, and it's like the singing and like the light,
Like way back in there
like, wouldn't it be cool to see like the beginning of like
of
all of
time.
this? And I'm reading Otherlands right now, which is kind of about that. So I'm always thinking like, what was it like?
What
So
was
I don't
that like
know.
in the beginning?
Yeah.
Okay. That's a totally
Okay.
interesting question. All right. What's your favorite ice cream flavor?
Chocolate.
Chocolate.
Yeah, just basic chocolate. Maybe with some brownie pieces.
Oh,
Yeah.
brownie pieces.
Yeah.
Okay. Let's see here. If the toilet paper roll is really low, but not completely out, do you replace it or do you leave it for the next person?
Um, I replace it. I replace it now. Maybe I wasn't always that way, you know, but
Leave it.
Okay, what's your favorite clothing brand?
oh, I like let's say Legence. I like Legence.
Oh, okay. I'm gonna have to look that up when I leave.
Sounds fancy. Yeah.
That is
Yeah.
tough. I don't
Well.
know what my favorite is.
You are a Quince girly.
I lately like I got these jeans from J. Crew that I
Oh,
love,
yeah.
and
J. Crew's good.
poetry linen. If I had unlimited funds, I would be all poetry.
Okay, this is good news. This
Yeah.
is good information. Okay, last one. Do any of you either currently own any stuffed animals?
Oh,
Only ones for the dog to
Any dog toys?
Yeah.
You do?
I actually
Sentimental.
got for my birthday from my little Wesley, my little 2-year-old grandson,
Oh, you did a snuggle
a Snoopy with his little voice in it. So it's like the best
cute.
ever.
Oh,
So.
that
Oh
is
wait, I should say I do. I have one. I have a Ridgeback stuffed animal that's in my Chloe shrine. My old dog from marking our territory. Will, who has Ridgebacks. When I had my Ridgeback, he was a must follow for any large dog parent. I think too, especially he's so
Really
wonderful.
special dog.
choose your
so.
heart dog, choose your heart and soul.
Yeah, yeah.
Okay.
All right, here we go.
All right, so those were our just random questions. So now you know more about Carrie and Dr. Lisa. All right, so here's the first question. Our vet has told us that chemicals are in heartworm treatments. The chemicals that are in there are worse than actual heartworm, and instead to just do a 6-month heartworm test. Considering where we live, it's really not that common. And they also said to never do a Lyme's vaccine because it doesn't work. What are your thoughts on that?
I'm just trying to look up. I'm going to go to the Heartworm Society website, but basically my thoughts are, you know what I always tell people, heartworm, it's a really awful disease. I mean, this is definitely, spoken by somebody who hasn't seen heartworm, treated it. I don't really know. It's so unbelievably, not only is it a terrible disease, right? Causes like lung and heart failure, but it's really awful to treat. It takes about 8 months to treat, painful intramuscular injections where dogs often have to spend overnight in the hospital on pain control, and thousands of dollars. And it's so incredibly preventable. And it's just not true. What I was looking for is what I would suggest you do is go to the American Heartworm Society, has the heartworm map. And it's just not true, especially like, I mean, this happened when I was in California, when I went to vet school in California. It's like, people are like, it is uncommon there. It's also uncommon here, but it happens. It definitely happens. And we're seeing it more and more every year. And it's spread through mosquitoes. I don't know about you guys, but like I go to sleep and I wake up with a mosquito bite. Like, I don't know where it came from. It doesn't matter if your dog doesn't, also go outside, but we also rescue a ton of dogs. It's very common in the South. And we rescue a ton of dogs from there all over, so all that needs to happen is we bring that dog over, a mosquito bites them and then bites your dog and they have it. And it's just so incredibly not worth it. I have never seen an adverse effect, a true adverse effect that I can point to, like a really deleterious one from heartworm treatment. So it's just so
Prevention.
the prevention, sorry. Yeah, thank you. From the heartworm prevention. So it's just so incredibly worth it. Yeah, but I do have people who once in a while want to refuse it for whatever reason. We go through all of the risks. And then if you do refuse it, then I do agree with the protocol to test every 6 months, because it takes about 7 months to, fun fact, only female mosquitoes carry it. And also it takes about 7 months to actually show up in blood work. So testing every 6 months then and treating earlier rather than later is going to be your best bet. But just like, why? Why? I don't know. I don't know. So I understand. Yeah, that's it.
I'll
Period.
add
The
on to that. I don't understand that statement that the treatments, what did it say about the
The
treatment?
prevention
The
is worse
Prevention
than,
is worse.
yeah.
Well, for two reasons. One is, there are a degree of risks with everything that we give our dogs. And I think that the heartworm medication is one of the safest medications. It's been most proven. It's been out there for the longest. And the other thing is I did import a male dog who did test positive for heartworms.
Oh, shooty.
And that was an ever-loving nightmare. I cannot believe how bad that treatment was. We had to keep him basically confined, like take him out on a leash to go.
Oh, right. I didn't even mention that. Right.
It was horrible. Like, I
Right.
mean,
I'm not even thinking about your quality of life. I'm just thinking about my treatment. So yeah,
yeah, I
awful.
mean, this poor guy, I mean, you just look at a golden retriever. So at any rate, like that's my perspective is like,
Always
that
treat.
was a very difficult and long treatment. And I have sworn I will always keep my dogs on heartworm.
Yeah, I want to emphasize that for about 6 to 8 months, your dog is truly confined, because if they are getting the treatment kills these little worms that live inside of like the pulmonary vessels near the heart. And if we kill these worms, you can have a worm embolism and they can just suddenly die. And the best way to prevent that is by keeping them basically in a cage for 6 to 8 months, so that they don't suddenly die. It's awful. It's everything about it's terrible.
2-year-old
So
golden retriever boy to have to do that. It was terrible. So
Poor
Ugh.
baby.
yeah,
Poor baby.
yeah. Okay. And then what about Lyme? The question, the other part.
Lyme, yeah. Lyme is a pretty controversial one. Um,
That would be the leptovax. Is that right?
nope, so Lyme is a tick-borne disease that carries Lyme disease. You probably hear about it a lot in people, like making people really chronically ill can do the same thing in dogs. Leptospirosis is a bacteria. They're both bacterias actually, but leptospirosis is the bacteria that's usually carried through the urine of mammals. Specifically, I mean, commonly like rats in New York City or the more suburban areas, or like wooded areas, but the urine of lots of mammals, and they get it by like drinking it. And it doesn't have to be kind of direct, it can be like in the ground but it usually lives in like standing water, like rivers, lakes, streams. And lepto can cause kidney and liver failure. And leptospirosis is actually now considered a core vaccine. That's new. That's new as of like a couple of months ago, less than a year ago. So distemper parvo, rabies, and now lepto are actually considered core, meaning that the American Veterinary Medical Association, the AHA, American Animal Hospital Association, who makes our guidelines, our gold standard guidelines, now recommend it for every dog everywhere. Core.
Do you know
Lyme. What?
do you know why that shift? Because that's recent.
Yeah, it is recent. It's really recent. I think just the advent of, seeing it more and more and having it be, again, somewhat of a preventable disease. For sure, everybody does not treat it as core still. But I mean, I would imagine for Goldens who love water,
Oh, gosh.
and there's a lot of fear around the lepto vaccine because the vaccine used to be a little bit more reactive. Like we saw reactions at a higher rate to the lepto vaccine. That's no longer true.
Oh, really?
So now we really don't see rates of reaction any higher than like our distemper parvo or like our distemper parvo vaccine. I think rabies still has a higher rate of reaction. But yeah, uh, so yeah, I didn't actually do lepto for Chloe. Chloe hated water. She would just run away from it, but I always debated it. I always was like, but we still live in New York City. I've seen it in tiny dogs who just don't leave purses. So, you just don't know how some of them come down with it at the end of the day. And
Yeah.
it is a pretty terrible disease. And so I didn't vaccinate Chloe for it, but I did vaccinate Herbie for it. He loves he will just drink other dogs' pee. I mean, so he just, yeah, I'm just gonna call it, you know, they squished its skull, Carrie, you know? Literally it's squished, like that's the thing of it. So yeah, he will drink other dogs' pee. So I vaccinated him. We had no problems, but you know, I can only tell you, and I will always tell you what I do for my own pets. Doesn't mean it's what you should do for your pet, but
To make your decisions.
yeah, I did do it for him. But Lyme
Yeah.
is a little more conscious. So Lyme is considered a lifestyle vaccine, meaning based on your dog's health assessment, lifestyle, etc. I find Lyme to be very interesting, and it's a very tough one for me because I think that we used to have Lyme vaccine for people, but they actually took it off the market because they found it pretty ineffective. There's, I think, research going on now again for people to figure out, like, try to make one for them. It's not totally ineffective. There is some effectiveness to it. The problem is, like, the bacteria in Lyme is kind of always changing. It's a little hard to keep up with. Lyme's a really awful disease, and it can cause kidney failure and death in rare cases. Um, so I think for me, Lyme is like if you are in a really high risk area, like you live in Lyme, Connecticut, or yeah, you're in the woods all the time. It's something to consider. One of the things that I don't love about the Lyme vaccine, which doesn't really have to do with the vaccine itself, but I think there's a lot of false sense of security with it because Lyme is just one of thousands of tick-borne diseases. There are thousands of tick-borne diseases out there now. And so I think it is really important to do your flea and tick prevention as well. So,
I was going to ask you about that. If they are on a tick prevention and a tick gets on them,
oh, that's a popular one. You know what? I should do a post on that. I really like that.
yeah,
Um, uh, if you are on an oral flea and tick preventative like Simparica, NexGard, Bravecto, the way that they work is that the tick has to attach in order for them to, like, you know, they're taking a blood meal with the medication in it, and that's what kills them. They're thought to be very, very effective. We don't really know the time that it takes for ticks to transmit tick-borne disease once they are attached. For Lyme, it's thought to be around 24 hours, but there are other tick-borne diseases that we think actually can transmit in more like 3 hours. So, you know, nothing is perfect, and people are like, oh, my dog's on flea and tick medication. Why did this tick attach? They actually have to attach with the orals in order for them to die. And then same thing actually with, like, I think like Frontline or Revolution, although with the Seresto collar, they will die if they bite them, but for the Seresto collar also has some repellent activity. In some of my like very high risk cases also, like when I would go like hiking with Chloe and stuff, I would sometimes use the Seresto collar in addition to the orals. So I would do an oral flea or tick medication, and we would put the Seresto collar on like 2 days before going for a hike and take it off like 1 to 2 days after. So it's just extra repellent as well as, like, if they bite, they'll die. So
Okay.
yeah.
Oh, that's so
Thanks.
interesting.
Okay, well, since we're talking about vaccines, like, do you want to talk about vaccine schedules or the efficiency of, is it titers?
Well, so many questions came in from people wanting to know. There's a lot of questions about titers, and including why don't all vets offer them? So you could even explain, you know,
And what is a titer?
yeah, how the
Like, I don't know
titer
what that
works
is.
and why somebody would use that. And also what the recommended vaccine schedule is, if there's a standard across the country, or if that depends on where you are.
Yes, so a titer is a measure of antibodies in your blood to a vaccine. That's kind of one of the things that we go on to know if a vaccine has been effective or not. There is the rare, like, non-reactor. But we also know that antibodies are just kind of part of the equation for immunity against a certain disease, but that's just what we can measure. So they're very controversial because we have a threshold to say, like, if your antibodies are at this level, you're probably protected against this disease. We don't know for sure, but you probably are. And if you don't have this threshold, you might still actually also be protected because there's more at play in immunity than just antibodies. But
Interesting.
we don't know. And if the titer is low, then we would say definitely get vaccinated again. The reason to titer would be, I mean, there are people who, the risk of vaccines is very small, up into including death. It's never happened in my hands. Thankfully, I've never seen a pet die from a vaccine, but I know vets who have. It's very rare, but it can happen. The worst I've seen happen is like low blood pressure, vomiting, facial swelling. They spend like a night in the hospital, or even they just get an injection or some oral medications and they're good to go next day. So for people who want to avoid that risk, again, even though it's a small risk and we're talking about very deadly diseases that we're protecting against, it might be a good starting point. It's definitely a good option for dogs who are maybe have like autoimmune or immune mediated diseases where we don't want to necessarily stimulate the immune system, or where they're, older, chronically ill, things like that. So all of that, those might be good options for those pets. The reason that a lot of vets don't offer it, hopefully that made sense. Did that make sense?
Yeah,
That was
yeah.
good.
The reason that a lot of vets don't offer it is, I think, manyfold. Number one, because they're confusing and we don't exactly know what it means, right? We don't know for sure that your pet is protected one way or the other, although we assume and have like a lot of there's just not like the definitive research on it to say like, yes, your pet is protected at this point. The other reason is because it's infinitely more expensive. I mean, you're talking, a vaccine is maybe around $40, $50, $60, and a titer test is probably more like $350, $400, depends what you're titering, but hundreds of dollars. So it's infinitely more expensive, and we don't really know what it means. And we can assure your pet, be really assured that your pet for it's a very, very small risk, and vaccinate them. So.
And is it still, because my parents used titers with their puppy, and they had to send the blood draws to a particular lab somewhere. It was not an easy access thing.
Right.
So is that still how, is it?
A lot of labs now, it depends, yeah, what you're titering for. Mostly the things that we titer for are distemper, parvo, and rabies. For distemper parvo, now a lot of like the common labs that we use do accept them, and they'll send them off to the other fancy labs that do the thing. For rabies, it depends on what you need it for. So rabies, though, the other thing is that if you so rabies, because it's required by law, even if you titer your animal for rabies, it's very what I call like academic. It's for your own knowledge, because the law does not accept rabies titers, meaning that if your pet were to bite somebody, that can be when that person, goes to the doctor, the Department of Public Health can report that and mandate that your pet be either quarantined or euthanized, usually in rare cases like involving kids, but usually they're quarantined. They don't care whether your pet has a titer or not. So the only thing that the law recognizes is that they're actually vaccinated for rabies.
Okay.
There are, though, international travel requirements for rabies. So if you go to another country, because there are a few countries that are actually considered like rabies free, like Hawaii, they take it very, very seriously. And you need to have like several titers sent off to like different labs, and it could take weeks to come back and stuff like that. So it depends what you want the titers for. There's almost no reason, I mean, to titer rabies, I think, other than for your own knowledge if you wanted to do that. But yeah.
And,
So,
and
and it's
one
interesting because if you also think about people, sorry, like I'm rabies vaccinated. And with me, I think they say like get my titers checked every like five, I think it's 5 years, 5 to 10 years or something like that. So it's just different guidelines.
Yeah, we looked at it because my husband and my son went to Africa, and paranoid mom, I was very worried about bats.
Rabies.
And
Yeah.
Bats.
Oh yeah, bats are,
Yeah, so
could be, yeah.
yeah. One thing that has caused me some hesitation also with titers is, we know that we're going to do, and would love to hear what schedule you recommend for vaccinations, but we know we're going to do them on a schedule. And if you titer and the number is theoretically sufficient to not need to vaccinate, then you have to be on top of that titer because it's an unknown how quickly it diminishes too,
Yeah.
the antibodies, right? Whereas with the vaccine, we know that
You
we've
know that you
covered.
covered it.
Yeah, so that's always been a hesitation of mine. But so what do you recommend? Like, what is the standard recommendation for the core vaccines?
For titering?
No,
No,
for the schedule.
Oh, for the schedule. The standard protocol is puppies every 4 to 6 weeks until they're 16 weeks old, so that they can, make their own immunity, because up until 16 weeks old, their mothers, once they nurse from their mother's antibodies are actually fighting off our vaccines, and then we know that their maternal antibodies wane around 16 weeks. I think it used to be 12 weeks, actually. They've changed it since, but now around 16 weeks. And then we give one final vaccine, and we know that their puppy can make their own immunity to it. And then it's at around a year, or 14 months, a year after those vaccines. And then depending on what vaccine it is, for rabies, distemper, parvo, after a year, it's usually every 3 years after that. And then, but for lepto is yearly, Lyme is yearly, bordetella is yearly, influenza would be yearly. So depends what the vaccine is.
Okay, great.
Yeah.
Okay.
But could you spread it out? Sure. I mean, the law doesn't care about, distemper parvo, and we don't have, there's no data that says, oh, at 3 years they magically wear off, so
Right.
I think the data shows that I think it usually does last longer, especially when you have a dog that's repeated, has repeat vaccines, but
Right.
those are the guidelines.
Okay.
Cool. Okay, the next question is, why do all puppies need to be dewormed? And is there a
Oh.
way to avoid worms in puppies?
I want Carrie to take this one.
Okay, go ahead, Carrie.
Well, and so I want to hear like, how does that worm cycle work in mom? Because this is what I know from my like working knowledge is that it's in mom, and the worms are in mom, and so those pass to the puppies. Like there's nothing we can do, even though we treat mom, the worms pass. And I see differing levels of worms in every litter. And that's so interesting to me. Like, even when we've done like the low dose safeguard starting at day 40,
Mhm.
we could still have puppies with worms. And so I'm fascinated by the durability of them.
They're durable.
And they are durable. And also the mechanism. Like, what is happening in utero or from nursing that is they end up in the pups?
Yeah, I mean, they can be transferred both in utero and from nursing, depending on what the worm is, or from fecal matter. And so, no, but you're right, they're very, very durable. And the best thing you can do is like be in like a bubble, a sterile environment. They just run rampant. I always say they just run absolutely rampant. Do you, and it still happens to you, Carrie? That's interesting. That I didn't know. I mean, I would think like, if anybody could get rid of them, you could, but I know.
It varies. Like with Poppins' last litter, I
Yeah.
never saw worms. So
Mhm.
not in her stool, not in the puppy's stool ever. And their stool was really good all the way through. But they'll, I've had moms like Poppins that like we've raised up from the beginning that have been on a regular worm protocol. They get their monthly and all that. And
Yeah.
still I'll see an occasional, that first Nemex dose, I'll see an occasional little white worm.
Yeah. The best way to know really is to like run a fecal, and test for them. I usually run a fecal antigen test, which just takes like, you don't actually even need to see the worm. They just test for like the antigens or the proteins that the worms put out, and we can detect it in like very, very low levels. They're just so hard to control in the environment, which makes it hard to control, everywhere else. But yeah, I mean, with a, deworming protocol of, yeah, like mom and then puppies, like every 2 weeks. But I always tell people also, like, if you get a puppy, like if you were to give me a puppy, I would not just deworm it. I would run a fecal and see what do they have to make sure that I was treating them appropriately, because you're not going to get, there is like a standard parasiticide that we use, But those are the ones that are preventing zoonotic diseases, meaning the diseases that are most likely transmissible from them to people. There are still other parasites that can be that can be significant, that we may not treat appropriately. You know, if we don't do a fecal, we miss them because we're just not using the right treatment. Herbie came with 3 different parasites. I mean, he was a puppy mill puppy, but so that's not surprising. But
Giardia, coccidia. Is that, I'm not
yes,
guessing
yes,
what he had, yeah.
Giardia, coccidia, and
I don't know what the
yeah,
third,
that's a tough one. He came with the tapeworm antigen from fleas, which, you know, I didn't see any fleas on him. He didn't have fleas when he
yeah,
came to me, which is weird. But at some point he ate one, and that's how you get tapeworms. So,
yeah.
yeah, he just came with all the things. Yeah.
So I have a question, because we do a fecal on the litter.
And by the way, sorry, he was dewormed to the high heavens. Like when I got his thing, he was dewormed like every 2 weeks, and I was like, "This is
Still have
insane."
parasites.
And we're finding now that like it's possible that they may be becoming resistant to a lot of our treatments. So
I can imagine, yeah.
Gross.
Plus, he was just in filthy conditions, so
like,
like,
it's gross. Yeah.
but so, you know, we do, or do a fecal at 7 weeks, you know, just so we can say that we're sending home puppies that have a clear fecal. I'm just curious, like, because they can be asymptomatic and get, let's say, like a positive coccidia or a positive giardia. So what do you do as a vet if that happens?
That's a really good question. A lot of times in asymptomatic puppies, we won't treat, we'll retest. Usually for me, for our first time, it depends what it is. But a lot of times in asymptomatic puppies, if they're asymptomatic at first, I will usually treat still once, and then if they're asymptomatic, potentially retest at a certain point. It depends what it is. Like a lot of people will say don't treat coccidia. So Herbie had Giardia, for example, and I treated him and it didn't go away. And then I tested him for coccidia. There's actually brand new that it just came out with a coccidia antigen. Before it was harder to test for. It was a different test. But at the time it was like, whoa, I got his panel back and they just happened to add it on at that time and he was positive for it. And so usually they'll say like, don't necessarily treat for coccidia if they're not showing signs. But in this case, because I had a hard time getting rid of his giardia, even though he didn't really have diarrhea or anything, I said, I'm going to treat for the coccidia because I think that there's like a comorbidity happening here that one's making it harder to get rid of the other. So I just treated him and then it all went away. There are protocols there that can be like very confusing. We kind of go in stepwise because they can be so resistant to some treatment. I usually err on the side of treating at least once and hopefully trying to get it to go away.
Okay, that's so interesting.
I might skip around here just a little
Yeah,
bit
go.
since we have some little bit of time
Okay.
restraints.
All
What
right, I
about
talk a lot. You maybe
if
didn't expect that.
what if we have, or I'm saying blah 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 blah. This person says they need affordable dog food that's not complicated. What would you recommend?
Probably a kibble. Just you know, I think if you're gonna, so I think there's a lot of different ways of feeding. For me, it's mostly like, and I always say when it comes to dog food, it's like talking religion, politics, dog food,
It
because
is,
people,
and
Oh, yeah.
we know that,
so
and we're giving you
yeah,
just
so
yeah.
incredibly emotional. But I think that you know, kibble is really truly tried and true. I mean, if you need something like no mess, no fuss, easy, that's going to be fully balanced for your dog, because you cannot cook for your dog unless you really know what you're doing or you meet with a board certified veterinary nutritionist. And so the kibbles like Hills, Purina, Royal Canin, they have a ton of years of research, many board certified veterinary nutritionists on their staff. So I would say like grocery store brands are not my first preference. Boutique brands are not my first preference, but the ones with actual years and years of proven efficacy and safety with board certified nutritionists on staff are always going to be my go-to. So
Okay,
Yeah.
that's good to know.
And feeding trials would, you know, I think that like that's such
yeah,
an important.
any company right with board certified nutritionist who is actually on staff probably has a feeding trial. Feeding
Yeah.
trials can be a little controversial. Yeah, like they're 6 months long. They're only
Yeah.
like so
8
many days,
dogs. Yeah.
but they're what we got. So yeah, absolutely. A feeding trial is definitely a gold standard.
Okay.
And I should just say, because there were so many questions about food, that could be a 5-hour webinar with a board certified veterinary
Yeah.
nutrition.
And
It's too big.
there wouldn't be one answer.
Yeah.
There's a lot of nuance here.
That's right.
A lot
There's
of,
a lot of nuance and yeah, there's a lot of nuance.
okay. Do you feel like it's a problem for puppies to eat leaves or sticks or bark? Because they do. Christopher, we're talking about you.
Yeah, exactly. And he's probably fine, right? Has he ever had a problem? I mean, it depends. I think, I don't love it. I mean, I've seen a lot of shit, right? Can I say shit? I've seen a lot of shit, literally and figuratively. I mean, I see sticks that get impaled. I see little pieces that go wayward. I have seen a dog eat so many leaves, it's actually caused an obstructive foreign body, right? So if your dog is just downing them like he's, at a buffet, then we should probably be doing something about that. It's going to cause a problem. But like if they eat a leaf, or like chew on a stick, it's just such a fine line. I think you just have to have, this is where just like use your, common sense. If he picks it up, chews on it for, a few minutes here or there, it's fine. I let him try to be a dog, but
Right.
yeah.
Right. What do you put in your dog emergency kit?
Well, I have in my profile link, I did create an entire PDF on all the things that you should have in your for like disaster preparedness, emergency preparedness, toxin preparedness. So that's all in my link in bio.
Great. That's your Instagram. And what
um,
is your Instagram? Because I think I'm going to type it here so that everyone can see that.
Thank you. It's just at Dr. Lisa Lippman. So DRLISA, LIPP as in Peter, MAN.
At Dr. Lisa.
Yeah, so I made a whole free PDF that you can get on all the things that I
Dr.
think should
Lisa
be.
Lippman. Okay. Right. I'm going to put that in the chat or the
I-
question and answer. That way people can
I'm
find it.
I'm going to do like a quick follow-up on that question. If somebody's at home and it's 11 p.m. and their dog just ate coffee beans, let's say.
Wow. I wonder whose dog would eat that.
Yeah.
Hmm.
Do you have any problem with home use? What would you recommend for vomiting? And do you have any problem with a person having their dog vomit before they bring them into the vet?
So I think that's a loaded question. Not really loaded. I have lots of very, very definitive thoughts. I think that if you are, I wouldn't do it without the guide of poison control. So I would definitely call poison control and ask them, is this something that we should make vomit? Because not all things we should make dogs vomit. Some are caustic, some are, caustic or detrimental coming up. And poison control will walk you through how to do it. You could have, if you're like going on vacation in the middle of nowhere and there's not a place around for a long time, then we usually use, it's got to be fresh 3% hydrogen peroxide. Fresh meaning like it's got to be fresh, like you pour it down the drain and it bubbles. That's how you know also if it's fresh, just besides the expiration date, but you're going to want to buy a new bottle. Hydrogen peroxide has risks. It can ulcerate the stomach or the esophagus. It can cause burns and at worst, but at best, it can just make them really, really nauseous and feel really terrible. And so we definitely have better things to make them vomit much more, and it's not assured. And the other thing is that we only actually get them to vomit up maybe about 20% of what's in their stomach contents. So we don't always get them to vomit up like a ton. I am a big fan of, there's a product called Ready Rescue that is like at home. It's so it's like a charcoal product basically so if you're not sure, you can always give that. That's really, really safe to give. Yes, otherwise I would say just get to the vet. It's just so much easier. I mean, you saw that video of Herbie. I made him vomit. I took him to the vet to make him vomit.
Well, and the reason I asked you is because, I just think we have to be so careful. Like, I think we are unaware of what we allow into our brain through social media a lot of the time. And that's one of those things that I think kind of like gets in there is like, oh, I can just give them hydrogen peroxide. So I
Right.
had posted Rufus and Harper a couple Christmases ago. We had a really good time and had
So
to go to
fun.
2 days in a row to the vet for different things. And the video shows them on the floor with the charcoal everywhere. We're at the vets, and this is one of those videos that went viral. I think it had like 8 million views, right?
Oh,
So just thousands of comments, but I couldn't believe the number of
I
people.
gotta see that. I gotta see that one, Carrie. Can you send
Okay,
it to
yeah,
me?
yeah, I'll send it to you.
Let me duet with it.
But I couldn't believe the number of people were like, "Oh, you could save $1,000 by just doing it at home with
Right.
hydrogen peroxide." I'm like, "Oh
No,
dear."
no.
And so then I was
Right.
like, "I got to tell all these people, no, you can't, no, you can't." I feel like overly responsible for the comment section,
Yeah.
and I couldn't get through all of them. But it's one of those things that it you gets into the brain, and you don't really know
Yeah.
where you pick up it that oh, that's an okay
Yeah.
thing to do. And
That's
so,
right.
Mm.
Yeah, it really, and I had a case actually, oh, this poor dog, I had a case where it ate, yeast dough. What people, I don't cook, clearly, yeast
something
dough,
that rises.
yeast
Yeah.
dough.
Okay.
Yeah, that rises. And that basically what happens in the stomach, it rises and it turns into a brick. And not only does that happen, but also it can cause alcohol poisoning because the yeast ferments in the stomach and it can cause, so it's bad. It's bad all around. And she tried to make him vomit at home, did not work. The dog didn't bring up anything. And then I was like, oh, she just wanted to wait and wait. She wound up going in at like, midnight
Yeah.
and making the dog vomit, and they don't know if they got it all up. And then we had the increased risk of like alcohol toxicity because it was sitting there for a while. But so I just felt so bad for this dog having like all that hydrogen peroxide and then,
Yeah.
waiting and then still having to go in and still having to vomit. So yeah, it's not all that effective. And it's so irritating.
Okay.
So yeah, if you're in the middle of nowhere and you have no other choice, then let poison control walk you through how much and what to do after. And then even if you do have to do it, I still recommend getting to the vet because we'll give your pet then like gastroprotectants to try to prevent that like ulceration or
Mm.
Yeah,
So
yeah.
you
It was
just-
a thing. I mean, it was a big event when this all
yeah,
happened. I mean, they did a lot, and so at any rate, I don't. How are
right.
we doing? We're at 3. So
We're
do
at
we have a
3.
lot of questions coming in that we need to get?
We don't have a ton. There is someone just on that note. Is there a National Veterinarian Poison Control phone number, or is it just poison control in general?
Yeah, I really love ASPCA poison control. It's a $95 fee, I think, to call. It's so worth it. They're staffed 24/7 with veterinarians and board certified toxicologists. There's also the pet poison hotline or helpline.
Yeah.
Pet poison. Yeah, it's
I've
like
called
red
it. I've
lettering.
called it.
Yeah,
So
me
someone
too.
said,
I call it for my own dog because I mean it's impossible to know every single little thing. Yeah.
Okay.
So
Yeah.
someone had asked, they have a rescue cavalier with anxiety, although she's improving. She was prescribed trazodone. I don't know how to say it. But I use it sparingly. Do veterinarians recommend CBD, or is there not enough studies to support that use?
That's a good
yeah,
question.
I mean legally, there's a lot of questions whether or not like legally veterinarians can recommend CBD because I don't because why? Because why would anything make sense? Like we're the ones who should be talking about it and sort of our hands are tied, but I don't care. What I'll say though is, I mean, if I thought it was super duper effective, then yeah, sure, great. There are companies that I think are putting a lot of research into it, like Elevet, ELLE vet. That's probably the go-to one that most veterinarians go to now. They have some research around osteoarthritis and its use, but otherwise for anxiety, it doesn't really have it. We just don't have the research, and I haven't found it to be overly effective. We don't really know what dose to use. There are so many other things that I will grab for first. If you're looking for a supplement, I like Soliquin. I like Composure Treats. Those are pretty good supplements. And then what I always tell people is that when you're looking at supplements versus drugs, supplements are always going to be more expensive, less effective. So just
So
know
good.
that if you are already, if you're coming to see me, you're at the level past supplements most likely, right? Because now your dog's gotten to like here, it's just going to be, and I think supplements are great in multimodal therapy, but I think better living through chemistry. So many of these drugs are so safe and so effective. And there's
Research,
just,
science.
yeah, exactly. Science is great.
Okay, here's a question that combines a couple questions on my question list is about,
Also, give your Cavalier kisses for me.
oh, you gotta give that Cavalier some snuggles.
We love that.
Yes, they're so cute.
The squish skulls.
Squish. What do you recommend around dental care for dogs? Is there anything that really works to help with dog dental care? And then there's another question here that talks about how when dogs age, like how safe is it for them to go under anesthesia to have it done? Like what's your little
dental
take?
care.
What's your take on dental care?
But dental care, I mean, so I always, it's just like us, right? Like I always tell people, like if I ate a greenie every day, I'd still have to brush my teeth. If I added something to my water, I'd still have to brush my teeth. There's no proof that any of like these water additives really work. And there are some products that might be helpful once your dog has a dental, is in a really good like state of tooth tooth health. That some of them can be effective at helping to prevent. So there's one called Perio Support, I think by Vetris Science, I want to say, that I think is pretty good. And there's also a product called Teef, Teef. It's a probiotic that is added to the water, that's made by some really cool people, that I think is showing to potentially have some benefit. It's just all about keeping the oral health and the gut health, healthy. And that helps to fight off like things like bacteria. May decrease time to like plaque and stuff like that, but there's just no substitute for brushing. And I get that brushing is hard and we can't all do it. But then there's no substitute for like a dental procedure, because we really, just like I go to the dentist every 6 months and get my teeth cleaned, your pet should not every 6 months. Depends on your pet really, but yeah. So
Will you speak to the efficacy of non-anesthetic dental work?
yeah, it's a hard no for me.
I want to make sure that's in here.
Yeah. Yeah. So, I mean, I think the American Veterinary Medical Association has also released statements saying that, it's so many things about it. So number one, it's really important to look below the gum line. We miss so much by not. So if your pet's gonna go under anesthesia, here's the other thing, and have a dental procedure, they must have dental x-rays. Do not have your pet go under anesthesia and not have dental x-rays. They are critical, because we miss so much disease that happens below the gum line that we would never be able to see. Tumors, masses, but mostly disease that we miss below the gum line. So that's critical. Just like, I get dental x-rays also every year. It's really important to see what's happening below the gum line. The other thing is that non-anesthetic dentals are not fear-free. So imagine like somebody reaching in your, if you're a dog, reaching in your mouth with like a scraper. I mean, most people hate going to the dentist, right? I mean, that's because it's loud, it's scary, they have to stay still. The things that could happen if they take one wrong turn, like the possibilities are endless for disaster there. The other thing is that with like a lot of the instruments that they're using and that they can't follow up with, is that you're basically just like scraping the surface of the teeth, potentially creating more crevices for bacteria. And so it's just all around a hard no for me. So
Okay, since we're getting kind of low on time, I think maybe there's a couple questions about best practice. Like, what about like?
Well, and maybe this one too.
Okay, so my vet wants to give my dog, is it Librela injections for his pain? I'm afraid of it because of the FDA warnings. What do you think? Am I saying it wrong?
No, you said
no, you're not saying it wrong at all. I'm just thinking about where I want to go with this one. Keep it brief, but I think that Librela is out for a lot. So Librela is a once monthly injection for osteoarthritis in dogs. It works on something called nerve growth factor. It was out for a while, I think at least 2 years in Europe before it came here. And in Europe, everybody loved it. It was great. The efficacy was great. These dogs were doing amazing. It was giving them all their quality of life back. And then it came here and there has been an uprising in people saying that they have seen like adverse effects. I actually, a neurologist friend of mine posted something on Instagram. I can share the post with you, asking other neurologists if they have seen adverse effects. These adverse effects being the thought behind Librela being that because it works on nerve growth factor, that any dog that could might have like underlying neurologic disease, so like a spinal tumor or any kind of neurologic disease could suddenly get worse, usually like losing the use of their limbs, or things like that. So he posted something asking other neurologists what they're seeing, and half neurologists said they're not seeing it, and half the neurologists say, I'm seeing some things that may have been precipitated by Librela. Um, we probably need more, like, we definitely need to be taking some of these accounts seriously and looking into it, a little bit more. But overall, I think Librela is likely, again, benefit versus risk, is likely a very safe drug for a dog with osteoarthritis that does not have underlying neurologic disease. And that can be hard to roll out 100%. So there are small risks to these things. And I think it needs to be a conversation with your veterinarian. I definitely will still continue to use Librela. I have seen it be life-changing for dogs. Yeah, that's it. But it's a conversation for sure.
Okay.
You want to do just one of the best practices?
Yeah,
'Cause
what about, I would say, what are the types of things that we should be asking a veterinarian too? Like how, if we're interviewing for a veterinarian, like what are the types of things we should be asking?
Hmm.
Um, I always, not every vet loves this. I always, like I said, I tell you what I do for my own dog, or I always say, ask, what would you do if it were your dog? And it's a hard question for some vets. Like, they don't always love it, right? Because you're not me, and we don't have the same resources or knowledge or, lifestyle or whatever. So, but for me, that can help guide me a lot is, what would you do for your own dog? Um, I think most vets will answer it. I don't mind the question at all.
I think that the question was more about like, choosing a vet.
Yeah.
And
Oh,
and one question I have for you, gosh, this puts you in the hot seat maybe a little bit, and so
I'm
you
not afraid.
okay, you're not afraid. I still hear from puppy families, like this last round that I just sent home, that vets are taking the puppies away from the family.
Oh, yeah.
And so I have strong feelings about that.
Yeah.
To know what you think about that as a practice, and should that be a deal breaker on a vet that you're using?
I think it depends a lot on you, right? How comfortable are you with that? And if you know that that's something that you want from your vet, then ask for that to happen. Some vets will say, yeah, no problem, we'll stay here with you. And some won't. And then you have to think about if that's the vet that you connect with and want to go forward with. I totally understand wanting to stay with your pet. I mean, I fully understand it. So, and I think it's great. I used to do house calls, so I'm like all about doing everything in front of a client when we can. They don't want to be separated from their pet. There is the rare pet where they actually are better away from the owner. And that does sometimes, usually in the case of like very protective pets. So sometimes that is in everybody's interest. But
Yeah, I have
beyond
a
that
I
scenario,
have a Queensland healer, and my vet is like,
yeah.
No, you don't get to be in the room with him. He's better for
Yeah.
you when you're not here."
Yeah, exactly. And that might just be, um and then that's better for everybody, right? Because then they can get things done just quicker and more efficiently. You trust your vet, that's great. So, and sometimes it's just like practice protocol. So whether the vet wants to do that or not, that their hands are kind of tied if they're working for a certain practice. But I definitely appreciate the concept of, being able to stay with your pet. Like veterinary emergency room. So, if you go veterinary emergency group, I mean, if you go there, they let you like sleep overnight with your pet. You're allowed to watch them have surgery. You're allowed to do everything but like go in the x-ray room with them. And I worked for them a little while.
That's
And
so cool.
I think it's great. I think it fosters, you get to see what you're doing. There's less questions, there's less, suspicion. Overall, I think it's great. Um, but
Yeah,
I get it. Yeah.
I'm campaigning to get a veg here. It will never happen, but golly, it would be amazing to have one.
Why? They're just opening up like crazy, so they might.
Because
They
we
might.
just don't have, I don't know, we're just
Oh,
so,
boo-boo. I think that
Okay.
it could happen.
Okay, it could happen, it
I'm
could
gonna
happen.
Yeah,
add-
I think it could happen, Carrie. I think it definitely, I wouldn't be surprised if it happens at all. And you know, but there's pros and cons, right? To veg. I mean, veg is a standalone, excuse me, emergency practice. So, you know, if your pet winds up needing like specialty care, then you'll have to go to a specialty hospital. But for a lot of little things, you know, your pet eats something, they vomit, you want to just stay with them, cool. I mean, I think you should. So I think that's great.
Yeah.
Totally.
Okay, well,
okay,
we
we
should
should-
wrap it up. Just,
Okay.
I want to
Two-
honor your time.
Yes.
You're okay.
Thanks for, okay, two really quick questions, like fast. Someone said, what are your thoughts with respect to giving dogs ice to chew? Is it too hard for their teeth?
And this is also a post that I have. I give Herbie ice all the time. He loves it. I mean, if I was as thrilled with a no calorie treat
Honestly, right?
as he is, then that's great.
That would change my life.
Yes.
Okay,
Yeah,
and
I gotta, but I will say there's a risk to they can crack their teeth. They can
Okay.
crack their teeth on anything, right?
On
So I
any-
just
yeah,
I take my
exactly.
risks or crush it. You can crush it for them.
a little,
So yeah.
little crunchies. Okay, here's a last one is what can we give dogs who get really car sick?
Oh, I mean, there's an FDA approved medication called Serenia for car sickness. That's my go-to for sure. Works really great.
Okay,
Yeah.
awesome. All right.
Listen, you guys, Dr. Lisa's Instagram, like you could spend hours on that. It's really, it's fun, but it's also super informative. Like you have a great Instagram feed.
Thank you.
So just go there.
Means so much on the days I don't want to keep going like today.
Yeah.
So yeah.
Oh, and you know what? I do want to just mention also your involvement with pet loss community because it just
Oh.
is so special and it's such a neat thing that you, I mean, like you are a co-founder. Is that the correct way?
Yep. Mhm.
So it's you, and why don't you say what pet loss community is and we'll finish there.
I co-founded the pet loss community with Dr. Monica Tarantino, who's IK, the senior dog doc, who is another veterinarian and also a doctor of clinical psychology, who's I think she's the pet loss doctor on Instagram. It's mostly me and Monica. What'd you say?
I think she changed it to Pet Love Doctor.
Oh, Pet Love Doctor. Thank
Yeah.
you. Yes, she's
Yeah.
had so many changes. Thank you. So Dr. Katie Lawler. Yes, thank you. She's sort of taken a step back since because her mom was sick. It's mostly me and Monica now. But either way, we deal a lot with both actual loss and grief as well as anticipatory grief. So when your pet is diagnosed with like a terminal illness, or you just look at them and go, I can't live without them. We have support groups. We have specific support groups for anticipatory grief and pet loss and grief, as well as one-on-one support with counselors who are very available if you need kind of immediate relief around, you know, pet loss and grief. And it's just such a disenfranchised grief, right? Meaning like people don't think, oh, you lost a dog, get another one. You know, it's like, it's just, nobody gets it like we do. So yeah.
Yeah, it's a tremendous resource. So
Mm.
thank you so much. Thank you for hanging in there with us and being
Thank
patient
you.
with us
Thanks
My
to
pleasure.
everyone.
and for your time because that was
Thanks for
really,
having me.
yeah,
it was
wonderful.
so amazing.
Yeah.
Thank you.
Okay.
Okay. Bye, ladies.
All
Bye.
right.
Bye-bye.
Bye, everyone.
So
Bye.
What do you want to do?
I
You
just
do
want to
it.
make sure we don't lose
Don't lose the recording.
in the questions and all of it. This is, bye guys, but we'll figure this
We're gonna
out.
figure it out.
So I just leave it, right?
I think so.
Okay.
You just end it.
There we go. End
End
webinar
webinar
for all.